ese tanto tiempo para...
One of the strengths of the clinic is the fact that we're rooted in the neighborhood. And what that means is there's ownership of the clinic from the residents who live here. The patients who use our services are working poor, uninsured residents who don't have access to health care otherwise.
3 days old.
Jane Garcia is a personification of someone who has dedicated her life to her community. And because I believe who she is and the fact that she knows her clientele so well, she has become an apt spokesperson.
There's a difference between having coverage, being insured, and having access. And our focus is on having access.
When I think of Jane and the risks that she's taken, she came in when La Clínica was a relatively small, community-based clinic, didn't have a lot of different operations, and as a result of her leadership, she made conscious decisions to expand into many, many different areas, to actually go into multiple sites. That was a real stretch, but it was designed to meet the need of the community, and I think that's also underscores what's so important about Jane.
Jesus Garcia.
We provide all the prenatal care here. Those children become part of our membership, and that's important to us in terms of the continuity of care and keeping families healthy.
Jane has a very unique role because she's able to transcend local community healthcare settings and break into the policy arena, both at a state and a national level.
In Sacramento, we've been debating all year on a health care bill. Because of the training that I received working with Jane, I know almost intuitively, if not what they would need, I know to ask the question.
We let our policymakers know how certain policies are going to affect our community, but that in turn, we're able to tell our community what those issues are and how it might affect them.